I was completely ripped from the frame and thrown a good 200 feet and then tossed me out.
We were told he had a car accident.
I actually wasn't breathing. My dad had to give me CPR.
I watched my husband become paralyzed in the emergency room.
We received a phone call that Dwayne was in a motorcycle accident.
When patients and families first learn about a catastrophic illness or have a traumatic injury, the future's uncertain.
The acute hospital's role and responsibility is to get a patient stable. Rehabilitation really is that next step in their journey to getting back to life.
Our team that we will assemble for you and your loved one is very specialized, very highly trained, and very compassionate.
Staying in a small community hospital where they only see maybe 3 spinal cord or brain injuries a year.
Whereas coming to Shirley Ryan Ability Lab, somebody with that diagnosis is going to be on a unit where all of the therapists treat just that specific diagnosis.
They are not working independently, they're working as a team, and once a week they get together to determine whether or not the patient is meeting their goals, and if not, why not.
I wanted him to be in a place where I could feel like I could trust the people there and build relationships, because I felt it was so important that they knew my son because he was my baby.
All of our physicians and our team members come to rehabilitation with a passion.
We love to help make a difference in these people's lives. And to see them work really, really hard every single day is really motivating. It's motivating to me and it's motivating to the patient.
It's comparable to any Navy PT. I used to run marathons. It feels just as hard as any of those events.
I was very worried because I couldn't hold the bottle to feed Juan Emilio. And I, as a mother, wanted to do that.
On top, either one of these 2 fingers on this side.
She gave me the technique and she came up with the clock. That was amazing.
When I get up in the mornings, I kind of look forward to doing this because I'm going to be able to do something I didn't get to do yesterday, or I wasn't able to do yesterday.
While we see people at a difficult moment, we also see the magic of patient and family resilience. Our families are welcome to participate in every aspect of the treatment. In fact, we often find that family presence is a motivating factor for patients.
I'm able to see my kids just about every single day. So even though we're far from, Annapolis, Maryland, I'm not far from the important things in my life.
Our building is set up with the patient in mind. We have one side, which is our ability lab.
The labs themselves on the different floors, they're designed to be really open, and it's not just you in a room with a therapist. It's a community of people, a lot of people in the exact same situation, working hard together.
Our innovation centers are where the patient rooms are. That's where we surround the patient with their primary team. And all of them wrap themselves around the patient and the family.
We have a life center which provides education, anything from building a ramp or where they can find resources back home in their community when they travel.
We live in a residential area, so people can practice going to the cleaners, going out to dinner, going to the grocery store.
It is an uplifting, energizing, bright, cheerful place.
I get excited when I see a therapist working with somebody and the patience that they have, and they make them laugh, and that it's really about the whole person.
With the appropriate intervention and with an intensive interdisciplinary team at the ready, patients will make progress, and that we will be able to help families adjust to the new normal that they're going to face following the injury.
I think about all the people on our journey that have contributed to this. The people here are precious. They embraced us. They understood how our hearts were hurting.
We've met the neatest people that are going to be very hard to leave. But we are ready. We're ready to get on with our lives. But I think part of our heart will stay here.
It only takes a second to change your life forever. 1 second. And it's incumbent upon us as parents to give him every opportunity for a full recovery. And that's what we chose to do when we fought to get him here.